Aging of the upper face usually begins in the late 30s to early 40s from gravitational pull on the soft tissues and facial animation patterns. In the forehead and brow areas, transverse wrinkling from frontalis animation and glabellar wrinkling from corrugator muscle action begin. Lowering of brow position usually begins laterally, but may occur medially. Low-set medial brows frequently are a congenital or hereditary occurrence. Lateral brow ptosis produces a sad, tired appearance, while medial brow ptosis produces an angry, harsh look. Descent of the brows is associated with overall descent of the orbicularis complex. In the upper eyelid, the pretarsal lid margin becomes obscured and there is loss of the aesthetic highlight of the superior lateral orbital rim. In the lower eyelid, orbicularis ptosis contributes to malar bag formation. Malar skeletal hypoplasia may produce rounding of the palpebral fissure, scleral show, or descent of the lateral canthus relative to the medial canthus. Senile changes may be associated with lid laxity and scleral show. To reverse aging of the orbicularis complex, it is logical to address rejuvenation of the brow and upper face simultaneously. The temporal hairline tolerates elevation superiorly and laterally without affecting hairstyle. In most patients, it needs to move 1 to 2 centimeters. Centrally, the hairline is very sensitive to elevation and should only be moved when there is medial brow ptosis. Transverse rhytids, visible in repose, are indications for frontalis scoring or resection. Glabellar rhytids in repose are an indication for corrugator division medially, leaving the lateral corrugator intact to prevent the brow from relocating too far temporally. The medial brow is usually at but not below the medial orbital rim. The lateral brow should peak at the junction of the medial 2/3 with the lateral 1/3 and should rise approximately 1 centimeter above the medial brow. The lateral canthus is usually 3 millimeters above the level of the medial canthus. To judge upper eyelid skin redundancy, set ideal brow position and estimate the redundancy according to the overhang of the supratarsal fold in a forward gaze. Medial orbicularis ptosis, or the negative vector polar bear look, is caused by descent of the orbicularis and malar fat pad. Scleral show and palpebral rounding may result from deficient skeleton, proptosis, or an atonic lid.